Well, there is some urgency to get people vaccinated, of course, as fast as possible, and there's evidence that variant strains are starting to spread.
So joining us live right now is UC Davis infectious disease expert Dr. Dean Blumberg. Thank you as always for joining us. Let's start out with the CDC's kind of new information about these coronavirus strains first detected in California. They are now officially variants of concern. So let's talk about the variants and what does that classification of concern really mean?
Yeah, so the variants of concern are those that are proven to have epidemiologic or clinical significance. And then there's other variants that are variants of interest and they've not been shown to have significance, but they're being tracked. So this is one that's definitely of concern. It definitely has significance. It's transmitted more than the past strains.
And we know that a lot of us have been wearing the mask, social distancing. We're getting the vaccines out now, but these variants that we're talking about here, could that kind of move the goalposts a little bit when it comes to actually having vaccine effectiveness and really getting to herd immunity?
Yeah, absolutely. There's two reasons for that. One is that they are transmitted more efficiently, about 50% more efficiently, depending on the strain. And the other is that some of the variants appear to escape vaccine-induced immunity to a certain extent. Probably not 100%, but they may make the vaccines less effective and less protective.
Well, let's talk about the three vaccines that are now available: Pfizer, Moderna, and Johnson & Johnson. And we've heard the concerns from some people about the overall efficacy of that J&J vaccine. So can you put that particular vaccine into context for us?
Yeah, so the Johnson & Johnson vaccine has 66% overall vaccine efficacy as compared to 90 or 95 for Moderna or Pfizer-BioNTech. But it has more than 90% protection against hospitalization and more than 100% protection against death. And then it's only one dose. So there are some certain advantages to the Johnson & Johnson vaccine. And I would encourage everybody to just get whatever vaccine is first available to them.
Yeah, we've been hearing that, not to be picky, get the one that's in front of you, right? Well, we're seeing more restrictions on businesses and activities being lifted in different areas. What have we learned about this virus now over this past year that's contributing to some of the changes we're seeing now?
Yeah, well, you can do a total lockdown and it's really painful. And what we found is by the contact tracing, we found what situations where we know that transmission is occurring. So the riskiest situation is the one situation where you can't mask, and that's when you're eating or drinking. So we know that restaurants and bars are going to be the highest risk areas, and we saw a lot of transmission in these areas, especially indoors. Whereas other areas, I think we can make modifications and we can safely then be out in public. All
right, Dr. Blumberg, thank you as always for joining us, and we appreciate your expertise.